Alright, good evening. My name is Myra. I'm going to be doing your pulmonary exam on you. First, I'm going to ask you some questions.
Okay.
Do you have any allergies to food or medicine?
No.
Do you have any chest pain?
No.
Any cough?
No.
Any shortness of breath?
No.
Any breathing problems at night?
No.
Do you smoke?
No.
Have you ever smoked in the past?
No.
Are you exposed to any environmental chemicals?
No.
Any asbestos?
No.
Any exposure of cigarette smoking?
No.
Okay. Do you have any history of asthma, tuberculosis?
No.
Any history of cystic fibrosis, bronchitis, emphysema, lung cancer?
No.
Any family history of lung disease?
No.
Have you had any surgeries of in your lungs?
No.
Any nose surgeries?
No.
Okay, very good. Next I'm going to do is, I'm going to start off with inspection. First I'm going to inspect my patient's chest size and symmetry. As I noticed, my patient's chest seems symmetrical. Chest movements are even. They're not and smoothly. My patient does not have a barrel chest. Prominence for the ribs, as I can palpate and see, they're not protruding out. My patient's ribs are fine. Next, I'm checking for the anterior posterior diameter, which is felt right from the xiphoid process, measured all the way transverse. We could use a measuring tape to do this. By patient, the normal finding should be the anterior posterior diameter should be less than the transverse diameter. Next, I am also going to check my patient's skin, front and back. As I'm noticing my patient's skin is intact, no lesions, no scars are noted, pinkish in color, no cyanosis is noted either. I'm also checking my patient's nails to see if there's any clubbing. There's no clubbing noted at all. My patient's skin is warm to touch as well. Next, I'm going to check my patient's respiratory rate. As I'm doing so, of course, I'm not going to tell my patient I'm checking his respiratory rate. I'm going to tell him I'll be checking his pulse. I'll be using his radial pulse for 1 full minute. As I'm doing so, I'm checking my patient's breathing pattern and rate. My patient's breathing pattern is within normal limits. It's normal. My patient's breathing easily and smoothly. Okay. No use of accessory muscles, no bulges, no retractions are noted at all. Okay. Chest expansion is symmetrical. Alright, my patient's respiratory rate for 1 full minute is 16 and my patient's pulse is 72. Very good. Next, I'm also going to, as I did my inspection and palpation, I'm going to inspect my patient to see if he has any superficial venous patterns, which will be located here in the chest wall or in the abdomen. As I did that, I did not notice any of that noted. Patient's skin is normal. Okay, very good. Next, I'm going to check for my patient's anatomical landmarks. Okay, first I'm going to check my patient's trachea. Please flex your head. As I'm doing this, I notice that my patient's trachea is midline, no mass is noted, and it's not deviated at all. Please come back. Next, I'm going to check my patient's suprasternal notch, which is located right here, right above the sternum, right there. Next, the angle of Louis, it's right below it, right at the midline level of the second rib. Next, right at the level of the xiphoid process over here, I could see the costal, can you just please go this way? Put it lateral. I could see the costal angle, which is right here, is where it meets the right and left margins, where they meet. Usually, the normal findings will be if the costal angle should be 90 degrees, which in this case, my patient has a 90-degree angle. Next, I'm going to be checking C7, which is right here. I'm going to ask the patient to flex forward his head This is checking for vertebral prominence. So the C7 should be right here. And right below it, the second bump, it would be the T1. That would be my patient's anatomical landmarks. Okay, next I'm going to be checking, as I also check my patients during inspections of breathing, I noticed that my patient does not have any audible sounds such as wheezes or stridors. Okay, next I'm checking my patient for thoracic expansion. I'll be using my two thumbs and my both hands and my thumbs together at the level of the 10th rib. I'm going to ask you to please take a breath in. Inhale, please. Take a good deep breath in and a breath out. And exhale, in and out. Okay. As my patient is breathing in and out, I'm noticing that both of my hands are separating equally. No deviation, and both of my hands were smoothly separated and even. Next, I'm going to check my patient for crepitus. I'm going to do that using palpations and using my fingertips. As I'm doing this, I'm also asking my patient to see if he has any tenderness or any pain as I am palpating. Do you have any tenderness or pain?
No.
Okay. I'm also noticing to see if my patient has any masses, lesions, or any bulges or anything like that. Crepitus pretty much it was like a feeling of a bubbly sensation. As I palpated my patient, I did not hear any crepitus at all. No bulges, no lesions, no masses, nothing was felt. Next, I'm going to do is a tactile fremitus. I'm going to please ask you to say 99.
99, 99, 99, 99.
Okay. Very good. As my patient said 99, both lung sounds were equal and symmetrical. They're both even. No abnormalities found. Next, I'm going to do is percussion. I'm going to notice to see my patient's pitch duration, intensity, and quality. Okay, so as I'm doing this, I noticed that my patient has resonance over all lung fields. Also, the pitch is low, quality is hollow, and duration is long. So that was noted during percussion. Next, I am going to auscultate my patient for breath sounds using my diaphragm. Take a deep breath in and out. Very good. My patient's breath sounds are clear and equal. I did not hear any abnormal sounds such as a rhonchi, any wheezes, or any friction rubs at all, or any crackles were noted either. Next, I'm going to do vocal resonance. I'm going to ask you to please count from 1 to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Really good. As my patient said, his counted 1 to 10. I heard it clearly. There was no abnormality heard at all. It was both even. Next, I'm going to measure the diaphragmatic excursion. By doing this, I'm going to percuss my patient's back, going down in the intercostal margins. I'm going to be asking him to please exhale and hold. Hold. And I'm going to stop percussing as soon as I see a sound change, in which I did right here. I stopped here because the sound change should be from resonance to dullness. So once I hear the dullness, I will mark my line right here, right there. I will use a measuring tape afterwards to measure the distance also from the diaphragmatic excursion. Okay, so right here is my first mark. Next, I'm going to tell my patient to inhale and hold. Inhale, please, and hold. Once again, I'm going to stop as soon as I hear the sound change from resonance to dullness, which is right here. I used before this video a measuring tape to measure between the two distance, and I got a measurement of 4 centimeters, and which is a normal finding. Normal findings are from 3 to 5 centimeters. Anything above 5 would be an abnormality, and anything below 3 is an abnormality as well. So that's how I would do diaphragmatic excursion. Alright, I am done. This is the end for pulmonary exam. Thank you.